Okay, greetings and welcome to yet another episode of Accountability Conversations with me, your host, Tina Malbanda. You can address me as Tintin. Well, today I have this sophisticated guest, as you can tell with the data glasses. Okay, so Sam, may you introduce yourself, the organization that you're part of, and the movement that you're pushing?
Alright, my name is Sibusiso Bhebhe. I work with Adolescent Zimbabwe. We are working with young people around issues of access to health.
Okay, which is our main mission today is we are talking much about young people and how they are affected in terms of health. So Seth, according to the demographic health data for Zimbabwe, nearly 40% of girls and 24% of boys are sexually active before the age of 18. And that really signifies the sexual activeness of young people who are even below the age of consent. Now, even the Public Health Act then comes and clashes with that, not allowing those people below the age of consent to freely access SRH services. Now, what do you say about this clash between reality and what is imposed by the law?
All right. So there are a couple of issues to address. The first one, like rightfully mentioned, that young people are sexually active, and with sexual activity then comes a number of health concerns. At the same time, it's important to note that these are actually children. They are below the age of 18. Their sexual activeness needs also to be considered in the context that who are they sleeping with? Are they sleeping together as young people, or they are actually having sex with other adults, which then becomes an issue of sexual abuse. So when we address the issue of sex amongst young people, we also need to consider the issues of child protection as well, which takes me to the issue of access to health.
Yes.
Currently, our law guarantees access to everyone in terms of the Constitution. Everyone has a right to access health, including reproductive health services. That's according to Section 76 of the Constitution. However, when we look at our Public Health Act, then comes the issues of consent, where a child can only access certain health services with the consent of caregiver or parent or an adult, as it were.
Okay, may you hold it there, say, you say that an adolescent can access health services with the consent of a caregiver. But looking at the African society, I cannot go with my mom saying that I want to access contraceptives. Shouldn't there be a certain way of allowing these adolescents to be responsible, to go there by themselves, because we are talking about the matter of their health and not the society's health?
All right, which is it's true, but also let's also consider the fact that part of responsibility starts from the decision that you're making. So the decision that we're talking about is that very decision that exposes you to pregnancy or to an STI. Of course, young people in their diversity would have sex for various reasons. Others are actually into sex work because of issues of survival, bread and butter issues. Others were married off as children. They're still children, but they were married off early. So we're now saying that young people should be able to walk into a hospital and be able to access a life-saving conversation, because from where we stand, we're saying that access to health is also a safety net for young people, which is a child protection issue. So we are losing a lot of lives that we could have actually saved had we given them enough information, had we ensured that they are able to access the health services. So I always say that, like in our African culture, if a girl gets pregnant, usually you are then sent to the guy who's responsible. I always say to parents, before you chase her away, answer these two questions. How did you contribute to that pregnancy? And how did you contribute to the prevention of that pregnancy? And then we can then discuss in terms of the responsibility that comes afterwards, whether it's the child's fault, or it's actually your fault as a parent for failing to give the child enough information for them to be able to prevent the pregnancy in the first place, or to delay that sexual activity.
Okay, I'm having a certain point that you're bringing out into all these health issues go in line with economic issues. Now, how can even the government get into that? What do you expect as a speaker for young people? How can the government get into that so that the health of young people is taken care of?
Studies have shown that if you keep children in school, particularly if you keep girls in school, issues of pregnancy and issues of child marriages are delayed. So the first port of call for me is let's guarantee the right to education for all children. This means that if you look at our reporting, maybe the 2019 report from Minister of Education, we had over 49%, about 49% of all school dropouts were recorded under abscondent, which means that they decided not to come to school from the dictionary definition. So when you then look at the other indicators that are there, where you look at maybe marriage was less than it's about 1.9%. There are issues of pregnancy. The numbers are so low, but if you look at other researches, they show bigger numbers, which means that probably the 49% that are recorded as absconded, they actually fall under the other indicators, which means that we are not following up on the children that are dropping out of school. So now we need to strengthen coordination between the community, the health center, and the school, so that if a child is not feeling well, whether they feel pregnant, while the Education Act says that they must come back to school, who guarantees that they come back to school? So if she gets pregnant, she goes on leave, who's going to follow up, say, after childbirth? Come to school.
That was so mouthful. Now, say on the 20th of June, it was reported that health workers decided to go on strike. They imposed a strike even after receiving 100% raise in their income. Now, what are the implications of that on our health as people?
It's the issue of access. As it is, we've got a law that is more or less a barrier to access, that's one. Coupled with the fact that our health workers are leaving the country, the ones that are trained, especially when you look at young people, we've got health workers that were trained on youth-friendly service provision. A lot of those are leaving the country. So it's another gap that is being created. If you look at, because of economic issues, for a health worker to be stationed in a rural area, which is a hard-to-reach area, it's becoming a bit difficult because of the bread and butter issues. When they're in the urban centers, they can work with private institutions and on a part-time basis, and they're able to earn an income here and there. But in a rural setup, it now means that we're making the vulnerable communities more vulnerable by not addressing some of these issues.
Okay, I hear all that, but at some point, this has a clash on our human rights for health. Now, what is the best way of handling such a delicate matter?
It's a bit of a tricky one, looking at our economy, but I would say that health workers are also citizens who are employed, who went to school, studied, and they deserve a basic, not even a basic, they deserve a good and stable life, which comes from a good and stable income. So we can politicize it, we can run away from it. The issue is we need to be able to pay people what they deserve.
Okay, rushing to our conclusion because of time. Apart from all these issues that we have addressed, what do you think are the other pressing issues pertaining health and young people, the main pressing issues that you feel like they need to be addressed, they need to be advocated for, they need to be dealt with?
Our laws are not youth-friendly. And I think that's because we do not have young people on the decision-making table. So you find that we've got adults making decisions for children and for young people, which is not entirely bad looking at maybe how we're raised. But the issue is we've got 3 or 4 generations now that we're dealing with, and their contexts are different. And young people on their own are a very, very diverse group, which means that in the context of SRHR, for instance, we've got young people that have never had sex. You've got young people that have had sex but not experienced any negative consequence. You've got young people that have had sex and experienced a negative consequence. This means that the messaging in terms of our health promotion for each group should be different. That's one. This means that the policy or the law that we're setting up should cater for all these 3 groups. But unfortunately, currently, in terms of our law and those that are making policy decisions, those young people are not represented at the table, so their needs are not catered for. So that's one thing that we need to really look at in terms of meaningful participation and inclusion of young people in policy and law.
Okay, thank you so much, Mr. Spoon, for joining us. Well, in all that you were saying, I captured these points that health issues have to do with economic issues also, and that diversity has to be taken heed of when trying to deal with matters pertaining young people. Well, stay tuned in another episode as we bring in solutions about all these matters. Thank you.